Let's talk health now. The Lagos State government has launched a Know Your Numbers, Control Your Numbers campaign to address health risks associated with hypertension and diabetes. In a statement by the Ministry of Health, the initiative aims to increase public awareness and encourage regular blood pressure and blood sugar screenings. The statement explains that the campaign forms part of the national 10 million project initiated by the Nigeria Governors Forum to address the widespread impact of hypertension and diabetes. Joining me from on this is the Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Ogboye. Good to have you join us on TVC Midday News. Talk to us about the driving force for this campaign and how many households or individuals you're targeting to reach in Lagos.
Okay, good afternoon. The whole point is across the nation to reach 10 million people with screening for the two silent killer diseases of hypertension and diabetes, which tend to actually go hand in hand together. So for the 10 million has been distributed across the whole country in terms of numbers and based especially on the population of each of the states. Lagos State is expected to reach about just under 800,000 people with screening for these two diseases.
So what is the campaign like? What is the modality? Is it door to door, or how do you hope to actually get people tested?
Okay, what we're hoping to do is to encourage people to come to our health facilities so they can get access to blood pressure measurements and then blood testing for sugar, for diabetes. This enables people to know their numbers. The whole point is to encourage people to know their numbers. These, as I said, are silent diseases. By the time you start to feel symptoms from any of them, then it's likely that it's started to take a toll on your body. So it's important to ensure that people know their numbers. So we want people to come out, get tested for both hypertension and diabetes, and then get referred for care if it is necessary.
All right. So in taking note of the numbers, is it only in government-owned health facilities, or are the private health facilities also involved?
We can't mandate the private health facilities to do it for free at the moment, but we are encouraging them to be a part of this drive. But definitely in all the secondary health facilities and the primary health centers, we have about 30 secondary facilities and about over 300 primary healthcare centers across the state. You can't get these tests done for free.
All right. So is there a timeline involved, or is it a permanent process?
Well, it's actually supposed to be for about a week to 10 days. But as the turnout goes, we will decide if there's a need to extend it. But the point is to stimulate people to take an interest in their own health. And hopefully, as they come out to get tested, we can get a lot of them also to enroll for health insurance, because that way you get regular access.
Permanent Secretary of the Lagos State Ministry of Health, Dr. Olusegun Ogboye, there talking to us about the Know Your Numbers, Control Your Numbers initiative of the state government, which is in line with the plan by the Nigeria Governors Forum to get 10 million Nigerians. All right. I understand that you're back with us, Dr. Ogboye. So could you just land on your thoughts, please?
Okay, so I mean, we're hoping a lot of people it will create an opportunity for people to get registered also on the Lagos State Health Insurance Scheme, which allows you to make one premium payment, and then you can get regular access to health care, and your numbers will then be monitored with you by a healthcare provider. So we're hoping that, this also introduces a line into that. But I think the basic thing is to get people to be more interested in their health, know their numbers. A blood pressure higher than 120/80 is something to keep an eye on, and people need to know that. And also, for people who their blood pressures are still normal, it's an opportunity to get educated so that you can continue, you can lead a lifestyle that keeps your blood pressure low. Get more interested in exercise, eat healthier food, eat a sodium low diet, get, like I said, get more exercise, and also just watch out for all the risk factors for diabetes and hypertension.
All right, then. So that is the message. Get screened today, know your numbers, and work with health practitioners to control your numbers. Permanent Secretary, Lagos State Ministry of Health, Dr. Olusegun Boye, thank you very much for talking to us on TVC Media News.
Thank you very much.